Hello friends, today we are going to discuss acute osteomyelitis, a very common condition especially in children. So acute osteomyelitis begins with infection anywhere in the body. It can be in the throat, nose, chest, anywhere. That becomes aginitis, and the bacteria can enter the bloodstream, and that condition is called bacteremia, bacteria in blood. So the blood can travel anywhere in the body, and the bacteria, working like a seed, can infect any tissue, and bone is not an exception. However, it is less commonly affected. In acute osteomyelitis, children are affected very commonly. So the commonest area of affliction is metaphysis of the bone, and diaphysis is very least affected organ. So the causes of metaphyseal affliction are high growth, because the metaphysis is the growing area, so there is so much growth happening and so much tissue debris is present, and the blood vessel is new thin wall vessels are there, where a single cell layer. Then there is blood stasis, a typical arrangement of vessel that leads to bacterial stasis. Then metaphysis area is also favorite place of trauma, and hematoma is formed following the trauma, and it attacks blood, and the defense system, reticuloendothelial system, is weak here. So ultimately it results in inflammation and pus formation if the host defense is weak. And the thick periosteum that checks the pus ultimately breaks down, and the pus enters the subperiosteal space. And after that, if the condition continues, the pus can break the periosteum and follow the tissue planes and comes outside as sinus. So in nutshell, pus in the middle cavity through Haversian canal and caniculi reaches the superior abscess, and then like a flute follows the least resistance path and comes out. So inner and outside path pus pockets can jeopardize the sandwiched bone in between, and that can become dead in some cases, and that can lead to dead pieces like sequestrum. And there is a new bone formation along the elevated periosteum, which is called involucrum. So these are some terms very importantly associated with osteomyelitis.